Hello, my name is Dr. Rob Williams. I'm with New Life Center for Bariatric Surgery in Knoxville, Tennessee, and today I want to talk to you a little bit about what to do if you've regained weight after your sleeve gastrectomy. So a lot of people I think get confused about what their options are, and what I want to do is just shed a little light on it and talk to you about the most common things you can do to capture some of the regain or to lose more weight if you never lost enough in the first place. So your options can largely be divided into two categories. One is non-surgical, the other is surgical. So non-surgical is usually a little less weight loss, but less risk because you're not going through a procedure, you're not having anesthesia. So non-surgical options, there's basically three of them. One is lifestyle changes. Some people who've regained weight after their sleeve have terrible habits. They usually know that when they walk in the door, and getting plugged in with a personal trainer or just kind of going back to the basics of the diet you were on after your sleeve can sometimes help you to recapture some of that weight you've lost. If there's been a lot of weight regain or there's a lot of weight left to lose, then sometimes it helps to see a dietitian. That's option number two. And most of the patients that come see me, I like them to sit down with the dietitian to go over their habits and kind of fine-tune those, because if you don't get your diet and lifestyle habits straightened out, most of the revisions that we have to offer are going to be a lot less effective. So your third non-surgical weight loss option is to try some of the GLP-1 agonists. So these are the new drugs that you've seen on TV that are very effective for weight loss, things like Ozempic, Wegovy, Zepbound. There's basically two drugs. One is Wegovy. The chemical name is semaglutide, and that's the same thing as Ozempic. And then there's tirzepatide, which is Zepbound or Mounjaro. So both of those drugs have been shown to be effective to help patients lose extra weight after a weight loss procedure. So if you've had a sleeve and you want to lose 20, 30, 40 pounds, oftentimes either Wegovy or Zepbound can be helpful for that. We see a lot of patients in my practice who want to lose more weight than that though. And when it comes to needing more weight loss, surgery is usually a little more effective. So with a sleeve, you have more options than with some of the other options. That's one thing we like about the sleeve gastrectomy. There are three procedures that we do after sleeve weight regain. The first is if your sleeve is too big, if it's dilated up and it's not restricting you like it should, we can actually revise your sleeve. So that's the simplest option. It basically means we go back in and we make that sleeve stomach smaller. The second option is a conversion to a Roux-en-Y gastric bypass. So a Roux-en-Y gastric bypass is something a lot of people who've had a sleeve know about, because a lot of times when they first had their evaluation, they were probably offered a Roux-en-Y gastric bypass, and it's a little more of a complicated procedure. The best role for a bypass if you've had a sleeve is if you have very bad reflux, because the bypass tends to help people lose some extra weight, but it also gets that heartburn or reflux under control, and we know the sleeve increases your risk of heartburn. So when somebody goes from a sleeve to a gastric bypass, basically we're going to take their stomach and we're going to cut it near the top and create a small pouch. And then to preserve intestinal continuity, we have to pull some intestine up and attach it. So basically it's going to have food skipping a portion of your intestine, and it's going to give you a little more restriction. And oftentimes people who have the gastric bypass from a sleeve are going to probably lose somewhere around 40 to 60 pounds of weight. But again, its biggest role really is in controlling gastroesophageal reflux disease. And then the third option, the one that I'm fond of mainly for weight loss, is a conversion to a duodenal switch. So a lot of people who've had the sleeve are not familiar with the biliary pancreatic diversion with duodenal switch. So that is an operation that involves doing a sleeve gastrectomy, but it also involves bypassing a large portion of intestine. And if you had a sleeve and you've regained weight or you never lost enough, the biliary pancreatic diversion with duodenal switch has the most weight loss of any kind of revision that you can have, and it's often on the order of 80 to 100 pounds. So if you're interested in hearing more about this, please check out our website or come see us at New Life Center for Bariatric Surgery. Thank you.